Welcome back to UC Davis Live COVID-19. I'm Satirius Johnson. Next week, we'll be celebrating Thanksgiving, normally a time for people to gather with family and friends, but 2020 isn't a normal year. So how can we safely mark the holidays in a pandemic? Joining us today to talk about this are two UC Davis experts with perspectives on preventing infection and on supporting older people and their caregivers. Dr. Natasha Tuznick is an assistant clinical professor in the UC Davis Department of Internal Medicine. She's an infectious disease specialist with experience in caring for hospitalized patients, and she specializes in infection control practices. And Dr. Teresa Harvath is the Senior Director for Strategic Initiatives and Director of the Family Caregiving Institute at the Betty Irene Moore School of Nursing at UC Davis. Her teaching, research, and clinical practice center on the health and healthcare for frail older people and their family caregivers. She's also the incoming president of the Gerontological Society of America. Thanks to you both for coming on today.
Thank you.
I just want to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We're aware of others posting links saying that you have to pay to watch this video. Please don't click on those links. This is a free webcast. And we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Dr. Tuznick, let's start with you. What are the risks of a conventional holiday gathering given the state of the pandemic right now?
Well, I'd say the worst case scenario of following conventional Thanksgiving practices is that it could lead to the death of a loved one or loved ones. The risks are substantial right now. And unfortunately, as everyone is well aware, we're seeing the highest case rates that we have since the pandemic started, and we just don't see it slowing down in the foreseeable future.
So I wanted to kind of start off our conversation basically like reiterating that the safest way to celebrate the holidays and not contract the virus is by not mixing households, right? And keeping in touch virtually, just kind of, staying strong that way for the next few months, hopefully, right?
Absolutely. And we do consider members of the same household individuals that have been living together for at least 14 days in line with the current quarantine guidelines. But you're absolutely right. It's something that no one wants to hear, but the real answer on how to best avoid it is to just not do it. But I completely understand about COVID burnout and being fatigued with not seeing family and being asked to batten down the hatches just a little bit longer, and that's been many, many months now. I suffer from that too with my family as well, but I know that we're here to give tips on what to do if you just simply can't avoid or choose not to avoid.
Right. So, okay. So if someone, wants to have some kind of gathering, but do so with lowering the risks, what are some of the things that they should keep in mind?
So, first and foremost, consider your own risk as well as the risks of those whom you are going to be visiting or having in your home. So, these are individuals who are of older age, and I'm sure Terry can comment more on that, but also individuals who have the classic risks that we've learned about through the CDC, such as diabetes, obesity, immunosuppressive disorders, etc. So, after considering that, if you still choose to do it, the recommendations, and I should note that the CDC had a meeting this morning and is going to be releasing even newer and more updated guidelines about holiday gatherings. So look out for that. But to keep the gatherings small, 6 individuals or less, and outside is preferable. I know it's a little bit colder this time of year and just not feasible in certain areas. But ventilating your house and opening doors or windows is recommended. Again, I understand that that's not feasible in some locations. And then again, masking when you're not eating or drinking, and being extremely vigilant about that, as well as practicing social distancing from individuals that are not normally in your household. So maintaining that 6 feet. And then also following really good hand hygiene protocols, and make sure everyone is on board. Don't go if there's an uncle or an aunt or someone who says, I don't believe in masks, I'm not doing that. And conversely, don't have those people at your house because it's just going to mess it up for everybody else.
Right. And if you have, say, more than one household gathering, maybe you could have each household sit at a separate table that's 6 feet apart, things like that.
You could, yes, you definitely can do that as well.
What about food? I mean, usually Thanksgiving is a really family style food event, or maybe it's a buffet. What can people do about, serving food?
Also a great question. Thank you. So as far as we know, there's no actual transmission related to food. The issue is sort of congregating around the food and then also sharing, utensils, because typically if you're passing something to someone, you're obviously going to be closer than 6 feet to that individual. So the current recommendation for the CDC is to actually show up with your own food, your own plates, your own silverware, disposable, to include your own salad dressing packets. So, I mean, they're really stressing that you should be 6 feet apart in your little bubble to include all of your food and everything constantly while you're in a different household or that different household is in yours.
Right, right. And then I know, I think part of the problem also is when you're gathering in a social setting, you're just so used to, maybe greeting someone with a hug or a kiss or
Mhm.
something like that. It's almost like an automatic
Yes.
thing that we do. So do you have any advice as to, how to keep people in the right mindset to just like not do that? Because you could start doing it without even thinking about it.
Right. I would set everyone up for success beforehand and make sure everyone is on board with doing that. And wave, make it very clear, no hugs, no kisses, wave at everybody. And then the one other thing I have to throw out there is, it's a time of year when some people choose to imbibe. And after a couple of drinks, sort of our inhibition gets let down. And that's when we tend to maybe forget about some of these things. So just, something else to consider, maybe limiting the alcohol that people are drinking. Just something else to keep in mind.
Right, right. Again, we are taking audience questions. So if you're watching us live, just leave them in the comments section and we'll work in as many as we can. Mary on Facebook is asking, do you see a role for at-home COVID tests? If testing is negative, why not have a gathering for those who test negative?
Um, Thank you for asking that. That's a great question. I was hoping this would come up. So the important thing to note about the test is the way that the test, and we're talking about the standard, this is not the antibody test, this is a PCR test for COVID. The way that that works is when you take the test, and let's say it's negative, all that means is that you are negative at that moment in time. It does not mean that you may not be infected with COVID or you may not become infectious. We have seen cases in the hospital and in the community where a person tests negative one day and then the next day they're positive. Then the question might become, well, what if I'm negative and we just go for a few hours? Um, Nobody really knows how many hours can go by between the test being negative and the test being positive. So again, it may be somewhat reassuring for that moment, but I wouldn't take full confidence that just because everybody was negative doesn't mean that there's not the potential for an exposure at a family gathering.
Right. And then I think there was a recommendation of having 2 consecutive negative tests as well. So it's not just the one test. And as you say, it really is just a snapshot of, okay, you're negative at this moment when you're taking the test.
Correct. And we know that approximately 40 to 45% of individuals are completely asymptomatic even when they're transmitting COVID.
Right, right. Um, Terry, this pandemic has brought to light some troubling issues in our healthcare system. What gaps has COVID-19 exposed when it comes to the role of family caregivers in the care of frail older adults?
Yeah, Satirius. Unfortunately, older adults and their family caregivers have borne a disproportionate burden of COVID. They've had higher rates of morbidity and mortality compared to younger counterparts. And they've also often been not first in line for getting the resources that are needed. We've seen this in nursing homes, which some of which have had really, really high rates of transmission and where the staff have not gotten the protective equipment that they need to keep themselves and their residents safe. In terms of family caregivers, the other thing that we've seen is that when everything shut down and we asked people to isolate, that for many caregivers, that left them without additional supportive services, either community-based services or the help from family members, friends, and neighbors who stay away in order to protect them. But the social isolation that this has caused for older adults and their caregivers is, I think, a serious problem that we need to pay attention to. We know that social isolation is related to physical and mental health problems for both older adults and their caregivers. And so I prefer to think of it as physical isolation and physical distancing rather than social distancing, because it's really important for us to continue to be reaching out in all of these virtual ways that we can to stay in touch with older adults and in supporting their family caregivers, because many of them are now carrying the burden and the challenges of caring for a frail older family member by themselves.
Right. I mean, there is a very big mental and emotional health toll in addition to the actual virus, as you say. So how can people stay safe and still feel connected? What are some good ways that people can still do that?
Certainly all of the virtual ways that we've are getting accustomed to, Zoom, FaceTime, these virtual ways, but also phone calls. It doesn't necessarily have to be a visual contact, but telephone contact is also important, and regular checking in and thinking about how can you engage this person in conversation, not just, hi, how are you doing, but think about topics that you would want to spark a conversation around, reminiscence, memories. This is a good time to reminisce about holiday traditions when the older person was growing up, so that it engages their thinking and their emotional reaction to the call that you're having or the time that you have with them. Even cards and letters, it's sort of a lost art, writing notes, but getting something in your mailbox and having the letter that you can read again, or a card that sits out on your table, is also a good reminder for older adults that their family is thinking about them and remembering them.
And it sounds like this might be a really great time to maybe reconnect with an older relative who you may have lost touch with. Maybe you don't speak to except on, annual holidays or something, and to really get to know that person, that an aspect of that person that you never really knew, just kind of get to know their day-to-day life and get to know more about their life in general.
Yes, and to coordinate with others around that. I'm third oldest of 10 children, and my mother just turned 89 and still lives alone. And we've divided up the days of the week. So a different one of her kids calls her every day of the week, so that we're checking in with her and alerting others that she's doing okay. And so it's really provided an opportunity for my siblings and I to be more connected than we were before this, because we've kind of coordinated communication among us on behalf of my mom.
That's really great. So, you're the director of the Family Caregiving Institute. How is the Institute supporting family caregivers right now?
When the pandemic started, we immediately, my colleagues and I in the Family Caregiving Institute, reached out to our national organizations that advocate on behalf of older adults and family caregivers, to ensure that we were paying attention to the needs of caregivers. One of the things that happened right away as things started shutting down is that visitors to hospitals were banned. And most hospitals made exceptions for parents of minor children and for partners of pregnant women, which are really important exceptions to make, because we know their well-being is enhanced when they have a parent or a partner with them during hospitalization. But no such exception was made for family caregivers for frail older adults. They were sort of lumped in the group of being just a visitor. And for some frail older adults, particularly those with cognitive impairment or with some sort of communication problem, either English is not their spoken or first language, or they have speech impairment because of stroke, or they're hard of hearing, having a family member there with them to advocate, to say what their baseline has been, how they respond to different treatments, is really important to their well-being. And so we've tried to reach out nationally to health systems, and through AARP, through the American Academy of Nursing, through the Gerontological Society of America, and other organizations, to advocate for older adults and to ensure that access to PPE in places where there are older adults is not forgotten. And so we've really tried to, operationalize all of our professional contacts on behalf of older adults.
And
That's really great.
just quickly, that's fantastic, Terry. I'm nodding my head aggressively because my father is 98 and he was hospitalized a couple months ago at the VA, and we were not allowed to go. And he's extremely hard of hearing, and he had a complicated course. So trying to explain it to him, because he's older and he doesn't want to tell the doctors he doesn't understand. So I would call him and say, do you know what's going on? He's like, not really. I just nod my head yes. And then at one point he was almost a little bit delirious, and I was, ready to go in guns a-blazing and say, I need to go see my dad. But I'm really happy to hear, because I completely think that that should be an exception as well, besides the other two groups of individuals that you had mentioned.
At UC Davis, our policy has sort of gone up and down. And when the spread rates in the community have been lower, I think we've actively worked to include family caregivers when an older adult comes to the emergency department, to clinics, to for a hospitalization. And I'm working with colleagues within UC Davis to make that a permanent exception that happens, that for frail older adults with cognitive impairment or communication problems, that we see the family caregiver as an essential member of the healthcare team. In March, I was actually with a family member who was in the hospital when everything started shutting down. And I got kicked out of the hospital during that time for about 18 hours until I was able to sort of argue my way back in. And, she was experiencing delirium, acute confusional states. She had a trach in, and so she couldn't speak and articulate what her needs were. And I think my being there was really essential in order to safeguard and to advocate for her, and to, indicate to the nurses and to the physicians when she was getting into trouble. And so, I think we have to see family caregivers to frail older adults as essential to the quality of care that we provide them.
At this point, that decision is left up to each institution, or is it something? So, how can you advocate for institutions to change their rules? Is there some sort of standard that you can kind of promulgate throughout the country?
We're looking at trying to do that through, for example, the Gerontological Society of America and other organizations that advocate on behalf of older adults. And again, I'm pushing hard within our own institution, because I think we need to lead in this area. And I think it is a value that is shared within UC Davis among my colleagues. This is, unprecedented time in history, and we continue to learn about COVID and its transmission and risks. And so I absolutely appreciate the being guarded and being concerned and being, cautious about what we do, because we don't want to put family caregivers in harm's way either. And they can be. And early on in the pandemic, when PPE was in scarce supplies in some areas, I can understand how decisions were made that that PPE needed to go to frontline healthcare providers. Now, as we got, more supplies under our belt, even with the rates increasing, I think we need to weigh the risks and benefits of a family caregiver being there and a family caregiver not being there, because it's not that it's harm-free for the older adult if their family member is not there with them.
Right.
As Natasha, as your dad probably needs somebody there to help him hear and understand and translate in language that is accessible for the layperson, in order to really participate fully in the care and in the treatment plan.
So we do have a related question from a viewer, Bev, who's watching on Facebook, asks, she says, my elderly parents currently have a caregiver who comes in to assist in their home for 4 hours. We're not sure if it's worth the risk. Are there guidelines that caregiving agencies are required to follow?
Yes, they are supposed to be following all of the safety precautions that any frontline healthcare worker is in terms of wearing a mask, hand washing, avoiding risks outside of when they're in the home. The family can reduce some of that risk by asking the caregiver questions about what kind of exposure he or she has outside of their home. What kind of precautions does that person follow? Look at mopping down hard surfaces after the person leaves, maintaining distances while they are in the house so that there's reduced exposure. Sitting at a distance. So depending on what the care activities are that they're doing, if they are more household related, light housekeeping, meal preparation, meal serving, then staying at a distance will be a little bit easier to do that. And everyone in the house should stay at a distance. If it's more direct care, bathing, dressing, those kinds of things, toileting, then they will have to be in close proximity to that older adult. And there again, the risks have to be weighed about how much risk of exposure, what are the underlying health conditions that this older adult has that may put them at even greater risk for illness burden if they were to contract COVID-19, and how safe is this caregiver being? How much are they adhering to the precautions outside of the home? Because if they are, every person that they encounter is an exposure that they're bringing into the home. And I don't want to minimize the importance that this help can provide, but it's a weighing of the risks and the benefits. And that has to be an individual decision based on as much information as the family can garner from that particular caregiver and the other people that caregiver is seeing.
Right, right. I guess you've kind of touched upon some of what this next person is asking about. Danny on Facebook asks, what are ways to minimize the risk when introducing someone new into your bubble for family care, i.e. we've been isolated for weeks, months. Are there safe ways to bring in a family member who has been doing the same? So say not only just a family caregiver, but say you want to include somebody new into your bubble to maybe help out. What's the best way to do that?
I'll also ask Natasha to weigh in, but I think, part of it is, are they willing to quarantine for 14 days before entering the bubble?
Agreed.
I think we know that's the best way to minimize risk, and that quarantine needs to be faithful to the quarantine. It can't be a partial quarantine. And then once they have entered the bubble, that they, commit to staying quarantined or staying within that bubble and not having the outside contact, not having the exposure. And, I understand that 2-week quarantine can be difficult, either before they arrive or, before they enter the house, but that's really the safest way to ensure that they're not bringing disease in.
I agree completely. That's exactly what I was going to say is there is no other way. Not even testing negative and going into the house is going to be as reassuring as doing a 14-day quarantine. So that's absolutely the best way to do it.
Mary on Facebook is asking, what is the prevalence of SARS-CoV-2, which is the COVID-19 virus, in the Sacramento area? What's the infectivity of the virus? And can you speak to the real risk of contracting COVID if we decide to move ahead with a large family gathering?
So right now, the information can be found, like if you want accurate numbers through a CDPH, the California Department of Public Health. And also the Johns Hopkins website has a daily COVID-19 tracker that's updated real time, minute to minute, seconds to seconds. And then as I believe it's only 4 counties in California that are not in the purple tier right now. So the rates have gone up.
The most restrictive tier.
Correct, the most restrictive tier. And then in terms of the infectivity rate, we still believe it's the same sort of R naught is something that we talk about in terms of infectivity. When this first hit, we thought that the numbers were maybe somewhere between, I can't recall exactly, I want to say it's somewhere around 2 to 5 or so. But there, we can say it's not as infectious as measles, but it's more infectious than a lot of the other classic infectious diseases that we previously knew about as we're coming to learn about this virus. And, we can't quote numbers like what is your absolute real risk if you go ahead and proceed with a family gathering. All we can really say is you can mitigate your risks by following the very stringent recommendations that I had previously discussed that are set forth primarily by the CDC, which is, again, you have to stay 6 feet away, you have to wear your mask, and you have to wear the mask properly. That's something we also don't talk about, is make sure it's over your nose and covering your mouth and that it's not loose and hanging. And if it's a cotton mask, it should be clean and have 2 layers. I mean, there's all kinds of guidance on even how to store the mask when you're not wearing it on the CDC. So if you're not able to just avoid, which is the best thing, or quarantine, then again, make sure everyone is on board, you and everyone else who's entering your home, or vice versa, that you're going to bring your own food, you're going to keep your distance, and it's going to be hard to do. I completely get it. Again, I'm victim to all of that as well, and it's frustrating too, but that's probably the best way you can mitigate your risk at most. But will there be zero risk? No, absolutely not. You're going to still have risk even if you follow everything to a T.
And, I would like to add, and I think we're going to put a link to this on the Facebook site, is that the Gerontological Society of America has developed a decision aid for people who are considering visiting an older adult. And this decision aid doesn't, put in your answers to questions and tell you yes or no, but it helps you think in a very thorough, comprehensive way what the risks are. Things like, is this a one-time opportunity that you have again to see this person? And so thinking about the risks to older adults that might come from family gatherings over the holidays, I think is really, really important. And it's a gift we give to them by being really certain about whether or not the risks are outweighed by the potential benefits. And I would encourage people to take a look at that. It's either a form that they can download as a PDF, or there's also a link that will walk them through the questions again, so that you can really understand what the risks are and to articulate for yourself what those benefits and whether they outweigh the risks.
And we're going to post a link, if it's not already there, I think it might be there, a link to that survey, that questionnaire, so people can look at that. Beverly on YouTube is asking, can you more fully describe what you mean by quarantine? No quick trips to the grocery store? So what do you mean by that?
Terry, do you want to go first, or do you want me to?
Yeah, why don't you go ahead, Natasha?
So in an ideal world, quarantine would mean that you basically don't leave your house for 14 days. Obviously, that is not realistic, but if you do only essential things, and I mean, everyone has a different opinion on what essential is, but the reality is an essential trip is going to be for food and possibly for gas or something related to transportation, or a pharmacy, which, for pharmacies now you can do a drive-through pretty much everywhere. And, for the groceries, even you could consider having them delivered or doing the pickups, which have been pretty popular. You order online, you go, somebody does contactless delivery, so to speak, by putting it into your trunk. So ideally, you would have no contact with the outside world. And I do think that that's more possible nowadays than it was before, just because everybody now realizes this is the new normal, unfortunately. So there are definitely ways to do it, I feel, without being too inconvenienced. The biggest inconvenience, of course, will be work. Some people just can't work remotely. So if you do have to go to work and you are around other people, technically it's not really considered a true quarantine.
Right.
Yeah, I agree. I was in the emergency department for a couple of weeks supervising some of our students this summer, and I quarantined afterwards because of the exposure. And I had groceries delivered. You know, I waited till the delivery person left them on my front step. When I brought them in, I wore gloves. I wiped down the hard surfaces before putting them away so that I really was minimizing, because I knew I had to go back into campus to work with other students, and I didn't want to bring whatever I might have been exposed to in the emergency department to those other students. And it can be a burden to do that. And yet I think it's really, really important, particularly when we're talking about gatherings that could include older adults or people with multiple chronic conditions that are at much greater risk.
Absolutely. Cindy on Facebook writes, I'm excited that UC Davis may be offering the point of care testing soon. Can you talk about that potential opportunity and how it may be utilized in congregate living sites?
I can't talk about that. Do you know anything about it, Natasha?
I mean, I know about the point of care testing. I believe Cindy is referring to the test that has been advertised pretty heavily on the news, the joint flu and COVID test, which is a 20-minute turnaround time. Again, I don't know how that is going to be applied in congregate living facilities. I didn't know if Terry maybe knew anything about that, but that's primarily going to be used outpatient right now, especially in the emergency departments. It's again, the idea is it's quick turnaround time, 20 minutes, because obviously volume is a big concern now that cases are going up, and it's going to be more difficult to kind of keep patients isolated while we're waiting on test results. But I think we're going to be seeing a lot more of that in the future. And since it happened to come up, I know we're not talking about the flu, but I want to just remind everyone too that flu is also a big risk and a concern this time of year. Again, elders are really at big risk, or the very young or immunosuppressed. And we don't know yet if masking is going to help to reduce the spread of influenza. We won't know pretty much until the season is over and we can kind of look back and see. But just want to remind everyone out there that COVID-19 is not the only risk, and people can die from influenza virus as well.
So what are the signs an older adult may have COVID? Are there certain symptoms that are more prevalent in someone who's older than somebody who's maybe not as old?
Mhm. Yeah, thanks for that question, because older adults, often with many different illnesses, will present atypically from younger adults. And we're seeing that as well with COVID-19. Older adults may not mount as high a fever as younger adults do. And so you can't necessarily go by the fever. They may not have the symptoms with regard to smell. But the kinds of things that should be early warning signals that we definitely want to pay attention to is any change in cognitive status, mental status, so increased levels of confusion. A lot of times older adults, that's the first symptom they'll present with is a change in their thinking ability and their memory. The other thing that you want to pay attention to is their shortness of breath. Older adults can get into difficulty quite quickly with COVID-19 with their breathing. And so if there's any indication that their respiratory rate is increasing, that they're having any kind of struggle with breathing, that would be something that you'd want to pay attention to and get them evaluated as quickly as possible, because it could turn more dire rapidly.
Mm.
And Terry, what about cough?
Yes, thank you. Cough as well.
Yeah, and Terry's absolutely right. I mean, we talk a lot about loss of taste and smell as not an uncommon symptom at all. But again, in the geriatric population, I know taste and smell are not always the most robust senses that are left over. So I would agree with that. Just change in mentation, just fatigue, and then the cough and shortness of breath would be big things to look out for.
Which makes it so difficult because those symptoms can be so many other things, right? So,
Absolutely. Again, crossover with the flu and just the common cold even.
right, right,
And yet, a sudden change in mental status for older adults, regardless of the cause, is something to pay attention to and
Yes.
right,
probably needs to be evaluated.
right.
Mhm.
And the flu vaccine is also recommended for older adults, especially.
Yeah, that's what it sounds like. It's has also that the testing of it has included older adults and that they seem to tolerate it fairly well.
So definitely recommended,
Agree.
Yes.
right?
Yes.
So, Thanksgiving is a week away, and then there's Hanukkah, Christmas, New Year's. So how can we cope, with this COVID fatigue as caregivers or just in general?
I think it's really important to recognize that as far as we can tell, this may be hopefully the only holiday season where these precautions, and so not see it as a forever change to the traditions that so many of us love and look forward to think about how we can modify those traditions in virtual ways or in distanced ways so that we can still enjoy the things that are important to us without increasing the risk that exists. And um and and again, recognize that probably the biggest gift we can give to family and friends is the reduction of exposure to something that could make them very ill or kill them.
Yeah, I agree completely, Terry. We talk a lot about, there's no end in sight on the horizon for this, but at the same time, we are hopeful that, like Terry said, this may be the only major holiday season where we kind of have to go through this and tough it out. I mean, there are hopefully some vaccines on the horizon. I'm sure everybody has heard about the two that are sort of on the docket right now. I don't need to get into those unless somebody has specific questions. But the hope is that maybe by next summer-ish, according to the NIH, hopefully there will be enough vaccine available for individuals and or illness, which, combined sort of brings us closer to the numbers of this herd immunity concept that has been talked about, where we can actually look forward to maybe having a holiday season again where we can do these things. And then a couple other things I want to mention too is I agree with Terry coming up with a new tradition. Just make the best of it. Everyone's calling it Zoom giving. And on that note, just FYI for people who don't know, Zoom is doing away with their 40-minute limit during Thanksgiving Day. So they're not going to have a limit so that they don't cut families off from interacting with each other. I've heard and read people planning on making place settings for the computer or a device, like one seat for this person, one seat for another person. And then the other thing I want to throw out there too is there's a lot of new technology that's available too that can actually be operated by the younger family members. So for example, there are these digital photo frames that are really cool that you can send to grandma or grandpa or someone who's not very tech savvy. And you from your own phone can literally upload pictures in real time, even if they're across the United States. So there is a lot of, there are not a lot of new ways that you can help engage a little bit more besides, just the phone calls or whatever social media platform you use to connect with members of the family, which is of course important as well.
Right, right.
And I think it bears repeating that, what we've learned in the last 9 months or so is that after every holiday, we've seen spikes in transmission. And that's been during the summer months when those were often outdoor gatherings that happened. The increased risk that being indoors presents is not something to take lightly.
Agree.
Right, absolutely. Even being indoors with the windows open, right? I mean, it's not
Right.
recommended. So I think the takeaway is this year, the safest way is to just, have an alternative type of holiday gathering, whether it's, outside, socially distanced, or just virtually, preferably. Just kind of get through this holiday season in a different way so that we can spend future holiday seasons with our loved ones the way we're used to.
Mhm.
Yeah.
Yeah.
That, my mom is going to stay home for Thanksgiving. She's not going to go to either of my sisters, which, is something that she's been doing the last few years. I've been invited to Thanksgiving at friends and I've declined those invitations. My daughter is not going to come. We are going to, stay put and Zoom and FaceTime and, enjoy each other's company, hoping that next year we'll get to see each other in person.
Mhm.
Natasha, what about
Agree.
you?
Yes, we're going to be doing just, members of our household. Same. And in case viewers are not aware, which I'm sure most probably are, but if you have family that is outside of the United States, WhatsApp is a great platform and free to communicate with people. I did that when I was deployed with the military and it worked fantastic. But, and you know, just to piggyback on what Terry said, and like you said, it bears repeating, is I know it may seem dramatic for us to sit here and say, well, the greatest gift you can give is life and not kill your family member or loved one, but that really is the reality. That is the worst possible thing that could happen, by just saying, you know what, I'm tired, I miss family, we're going to get together. That is a risk that you have to consider. Absolutely. There's no two ways around it.
Yeah.
We have one more question from a viewer, Sparking Joy on YouTube. Any idea if the new vaccines will have any egg in them, like prior flu shots?
That's a great question. I'm not sure of that yet. I do know that both vaccines that are on the horizon are they're novel in the way that they are delivered and sort of work, as the best way I can put it. So they're mRNA vaccines, which we don't really have any other mRNA vaccines. So I don't know that egg would be required or a part of that. So I can't say with confidence, but they are completely different than any of the other vaccines that we currently have. So that may end up being a good thing.
All right. Well, this has been a really great conversation. Thank you so much for coming on today to help us navigate this very challenging holiday season.
Thank you.
Dr. Natasha Tuznick is an infectious disease specialist and assistant clinical professor in the UC Davis Department of Internal Medicine. And Dr. Teresa Harvath is director of the Family Caregiving Institute at the Betty Irene Moore School of Nursing at UC Davis. On the next UC Davis Live, COVID-19, we'll talk about the phenomenon of COVID-19 long haulers, people who have lingering symptoms for months and months, and what we know about the long-term health effects people are enduring even after recovering from COVID-19. I'm Satirius Johnson. Until next time, this is UC Davis Live, COVID-19.